I'm Dave McGraham. I'm from Traverse City. I'm a physician, and I'm contracted to work about half-time as the medical director of the Northern Michigan Opioid Consortium. Jeannie Marriott is one of the project associates, and Jean, chime in anytime on these slides. You'll recognize all of them, or at least most of them. We are a team of 4 people, including Jean and I, as well as a project director and another project associate. And we cover 25 counties in northern Michigan, with a mission being to help coordinate responses to substance use disorders. I'm going to go through a couple of background slides. We've gotten fairly lucky, I would say, with getting federal grants. We have the RCOR, the Rural Community Opioid Response Program grants. We also have a psychostimulant grant and a behavioral health grant. These all come under our oversight organization, which is the Michigan Center for Rural Health. Why focus on these counties? The director of the Michigan Center for Rural Health, probably 6 or 7 years ago, started, and that was John Barnes, started getting concerned about what was happening with opioids and addiction in rural areas. And the Michigan Center for Rural Health is a rural focused organization, and John wanted to start figuring out what can be done to help these rural counties that are suffering from substance use disorders. And about the same time, the federal government, under the CDC's umbrella, was starting to see big issues with prescription opioids and migration to heroin, as well as an increased prevalence of hepatitis C and HIV, all in rural America. The thing that was in common with a lot of these counties, and our region as well, is a lot of these counties had multi-generational poverty, poor health conditions, a lot of social barriers to getting health, including transportation barriers. There were high opiate numbers being prescribed, and a lot of prescription drug use, and a high prevalence of substance use disorder and increasing deaths. So that's kind of a little bit of the background on these grants, and on how we started down the path of what we're doing. We're a team of 4. We have 2 very active committees that work within NMORC. One is the Prevention Workforce Committee. The other is a Treatment and Recovery Committee. And these committees work they meet once a month. We have about 50 member organizations that we work with. We have people from those organizations on a monthly basis attending these meetings. Doesn't mean 50 people are there. It's somewhere between typically 10 and 20 that we have. And these can be members of health departments, Catholic Human Services, or Up North Prevention, FQHCs, other healthcare entities, healthcare systems, recovery organizations, and others. And we have quite a few people in recovery that are part of NMORC. We also have quarterly meetings that typically have a topic of interest to the group, something about substance use disorder or something about what's going on in the region. We start all of those meetings with a person in recovery talking to us about their journey. And that was Joyce Fetro's idea as the director of NMORC years ago. And the thought is that if people in recovery kick the meetings off, that kind of helps ground us in the work that we're doing and reminds us about the core work that we're doing.